I'm presenting this on behalf of Bhawi. Many of you know Bhawi, but she had a family emergency. That's why she wasn't able to be with us. So our KAT6A, KAT6B patient registry, so now it's officially both communities, KAT6A and KAT6B. Prior to that, it was only KAT6A, so we worked hard to get it, to get both syndrome on the registry. So for the KAT6A gene, we have the core features such as intellectual disability, speech delay, microcephaly, cardiac anomalies, gastrointestinal complication. Genotype-phenotype correlation show that late truncation pathogenic variant, exon 16 to 17, are significantly more prevalent. Known cases worldwide, we have 396 so far. Mutation reported throughout the genes, variable phenotype occurrence and penetrance, late truncating mutation in exon 16, this is what we already talked about. The KAT6B gene, the histone acetyltransferase, falls in the same family as KAT6A, chromosome 10. Known cases of KAT6B 100. Mutation reported through most of the gene, variable phenotype occurrence and penetrance, mutation in exon 18, most severe phenotype, distinct craniofacial features, neurodevelopmental defect, microcephaly, intellectual disability, global developmental delay. We have renal abnormalities, cardiovascular anomalies, muscular defects. So the registry was launched in 2019, and it's hosted by a national organization of rare diseases. And it's a security cloud-based platform. Registry is compliant with US health information privacy laws and FDA regulations. KAT6B patients now are part of the registry since 2022. The goals of the registry serve as a database to enhance understanding of the full range of KAT6 related disorder, disseminate information quickly and securely to researcher and clinician, and enables researcher to identify trends that can generate new insight and identify area of additional study, guide the development of standards of care, and expedite the completion of KAT6 clinical trial. KAT6A and KAT6B patient or parents/guardians. We have also doctors or caretakers. This is where our data entry. And then we have guide standards of care, research, and clinical trial feasibility and recruitment. There are currently 12 surveys under the KAT6A, KAT6B patient registry. 6 of the 12 takes 5 minutes or less to fill out. And the survey details that are there, you have getting started, diagnosis, birth and family history, neurological, immune system, other condition. So on the getting started, you have type of mutation, genetic report, date of birth, and the sex. Diagnosis is date of diagnosis, test performed, publication, participation history. Then for the birth and family history, we have birth weight, head circumference, fetal abnormalities, fertility treatments, medical issues at birth, family history. For neurological, you have seizure history, neuromuscular weakness, developmental and language milestone, neurodevelopmental condition, ADD, ADHD. For the immune system, we have allergies, vaccination, metabolic, mitochondrial abnormalities, autoimmune conditions. And for other conditions, you have heart, thyroid, digestive, respiratory, pulmonary, kidney, bladder issues, hospitalization, sleep, vision, hearing issues, distinctive physical features. For medical history, we have weight, height, vaccine record, doctor visit record, treatment, medication, surgery, therapies, physical speech, and occupational, research participation history, genetic medical records upload, if any available, socio-demographic information, we have country of residence, education, racial designation, pediatric quality of life part 1, hearing, feeding, vision, mobility, communication, physical health function, and for pediatric quality of life part 2, behavioral anxiety, depression, peer relationship. So our suggestion to have the information below handy when you sit down to fill out the patient registry. Medical record, MRI, EEG test, hospitalization, genetic diagnosis, upload documents or write the diagnosis, any medication supplements used, amount, usage, purpose of them, information on hospitalization, information on all the current health issues, information on current therapy programs. What we have currently in the database, we have registered 317, consented 211 started survey, 159, and we have 151 who completed all the surveys. So 48% of patients who have enrolled in the registry have completed registry surveys. KAT6A and KAT6B cases known worldwide versus patient confirmed in the KAT6A, KAT6B patient registry. So we are aware of 396 patients worldwide, but we have 125 who completed the surveys in the registry. And we are aware of 157 KAT6B, but we have only 6 KAT6B in the registry. So we need to increase the number of KAT6B patients in the registry. Cases known worldwide, most of the cases you can see that there are in the United States with 129. We're talking in the Americas, Canada 19, Argentina we have 1 case known, Brazil 5, Chile we have 2, Dominican Republic 1. In Europe, you know, the country with the most known cases are UK 31, Spain 16, France 13, Netherlands 15. And all the other ones are like 5, 6 cases or less. Australia, we are aware that there are 19 cases, New Zealand 3 cases. In Asia, we are aware of China, they have 24 cases. And the next country is Israel, they have 7 cases. India, we are aware of 2 cases. One of them here. Patient registry data allows for analysis and identification of new trend. So common neurodevelopmental disorder, 78% are global developmental delay, autism is 19%, sensory processing 11%, and auditory processing 67%. And 64% they say that they have high pain high pain tolerance. 20% they have ADD, ADHD, and 80% have an infectious laugh. Issues at birth, 46% hypotonia, respiratory problems 35, microcephaly 28, jaundice 12, and no issues 31. So this is, please take your time to fill out the patient register, it's very important. How to request access to the patient registry, you can email KAT6A registry@gmail.com, and the KAT6 Foundation will review requests from researcher for access to de-identified patient data, so no one gets identified, all of them get de-identified data. In agreement with the standards set by NORD and the Institutional Review Board, IRB. Future direction, we want to publish registry data finding in a scientific journal. Autism spectrum disorder in KAT6A and KAT6B patient study currently, there is an agreement going on to have a study led by a researcher at the University of Nebraska. And we have a mortality review committee which is studying the KAT6A and KAT6B patient mortality reports in depth, including autopsy reports to better understand manifestation of KAT6 disorder in the deceased. And this is it. Thank you.